cancer. By cancer, they are the cells rapidly growing. And normally cells are at one place in the body and they're doing their task, what they have to do. These cancer cells are not doing that. They are rapidly growing and also spreading, going to other places. They can go, they can invade other tissues, growing over the tissue about, so be invasive, having malignancy, then be invasive to the sites, to other organs, or spread over the lymph and blood vessel system to other places in the human body. And they are a waste of things in the human body, and over time they lead to death if treatment isn't successful. And some other things general about cancer. Every second person statistically gets cancer in their lifetime, and the older the person gets, the more likely is it that they get cancer. Some cancers also have children, like leukemia, cancer of the blood, or cancer of brain or bones. Men and women have cancer overall equally. There are some cancers which women more have or men more have. And also some causes are named here, what cancer can cause. There is, let's say, in this book from the 80s, from 1982, that there are some suspicions towards some chemicals, maybe in the food, in the air, and the water. Some people who work with such chemicals might get more likely cancer. And then there's also said cancer is not hereditary. There are some things which make it more likely that some children get it more likely, but it is not hereditary. And there are some viruses which might cause leukemia or neck cancer, but in general, not so much. The main thing is cancer is not infectious. So there are some viruses which can cause cancer, but cancer itself is not infectious. And then we have written something to the terminology. They said neoplasm, that is just the growth of new cells, which are useless. And tumor is it when it's bigger, to be felt or seen. And carcinoma are the cancers called of the tubes of the gut or bronchi. And sarcoma are the cancers of the connective tissue, of the muscles, bones, ligaments. And they can have malignancy, that means that they are invasive to other places. And they can be malignant or benign. And malignant means that they are doing that invasive stuff, and benign means they're doing that not. But some benign can turn malign, so they're sometimes removed when they are benign. What symptoms do they cause? A bunch of symptoms. Cancer oftentimes just causes symptoms as soon as it is advanced to be destructive. And there are some general symptoms like loss of appetite, some fatigue, some mood changes, and weight changes, but also some other things like blood or mucus in the feces or in the urine, or other things. And now what can be done against it? Now the first important thing is the earlier the better. The earlier the cancer is found and treatment is started, better. Now what can be done? There's the idea of surgery, then it is just cut it out, maybe then in combination with radio or chemotherapy. So cutting it out is surgical, is an option. Another option is to make a radiotherapy. Cancer cells are more susceptible to X-rays, and therefore we're getting more. And also chemotherapy, where also these medications or whatever they are more infectious, more stronger going onto the cancer cells than on other cells. And how it is found out? There can be made X-rays, there can be swallowed a dye, which is then taken in stronger by the cancerous cells as the other ones, and then it can be seen on the X-rays or something. And other things, there can be made biopsy of the cancer itself, have things taken out and then looked under a microscope under it. And there can be looked into little specks of blood in the faces. There can be made then tests of a cervical smear for cancer at the neck of a womb, or testing the urine, or other things. And this is what your written is. And they are basically ending with advising with if in doubt, find it out. So they're saying the earlier it is found, the better. And if someone is doubting that maybe a mole is turning cancerous or some things or something like that, if in doubt, find it out, do they say. And early finding, screenings, checking for some things regularly might help to find it earlier and to help it earlier. And they're also saying that, and that already in the 1980s, that they were working on treatments and that they're making advantages to be able to cure and treat more and more cancers. So, and that is all according to the Reader's Digest Family Medical Advisor written by Keith Hodkins in the year 1982, on the pages 106, 107, and 108. But this is no substitute for medical knowledge and also no medical advice.